Imagine a world where the wisdom of ancient healing practices could revolutionize modern medicine. What if the secrets of healing, passed down through millennia, hold the key to a more holistic approach to health? This is not a distant dream but a reality unfolding before our eyes. Ancient texts and practices from Egypt, Greece, and India offer profound insights that are now being validated by contemporary science. In this journey, we will explore how the ancient roots of healing are not only relevant but essential in today's medical landscape. What can these ancient practices teach us about modern medicine? The Ebers Papyrus, dating back to around 1550 BCE, is one of the oldest and most comprehensive medical texts from ancient Egypt. This papyrus contains over 700 remedies, surgical techniques, and prescriptions, revealing a sophisticated understanding of herbal medicine. For instance, it describes the use of willow bark for pain relief, a practice that aligns with modern use of aspirin, derived from the same plant. The Ebers Papyrus also details surgical procedures, including trepanation, a practice that would later be refined by Greek and Roman physicians. What other secrets does this ancient text hold about modern medical practices? Hippocrates, often called the father of medicine, introduced the concept of natural healing around 460 to 370 BCE. His emphasis on the importance of the environment and lifestyle in health laid the foundation for modern preventive medicine. The Hippocratic Oath, attributed to him, underscores the ethical principles that guide medical practice today. Hippocrates also classified diseases into categories based on their causes, a system that influenced the development of pathology. How do these ancient Greek principles resonate with contemporary medical ethics and practices? Ayurveda, the ancient Indian system of medicine dating back to around 1500 BCE, emphasizes balance in the body through diet, herbal medicine, and lifestyle. This holistic approach is strikingly similar to modern integrative medicine. Ayurveda categorizes individuals into three dashas, Vata, Pitta, and Kapha, and tailors treatments to balance these energies. Practices like yoga and meditation, integral to Ayurveda, are now widely recognized for their benefits in modern healthcare. What can Ayurveda teach us about personalized and holistic health? Today, herbal medicine is experiencing a resurgence, with many pharmaceuticals derived from plant compounds. For example, the drug artemisinin, used to treat malaria, is extracted from the sweet wormwood plant, a practice rooted in traditional Chinese medicine. Similarly, the use of willow bark for pain relief, documented in the Ebers Papyrus, has led to the development of aspirin. Modern research is increasingly validating the efficacy of these ancient remedies. How are ancient herbal practices influencing modern pharmaceuticals? Integrative medicine, which combines conventional and alternative therapies, is becoming more common in modern healthcare settings. This approach acknowledges the value of ancient practices like Ayurveda and traditional Chinese medicine alongside Western medicine. For instance, acupuncture, a key component of traditional Chinese medicine, is now used alongside conventional treatments in the West to manage pain and improve overall well-being. How is integrative medicine bridging the gap between ancient wisdom and modern science? Acupuncture, a practice dating back to around 100 BCE, is increasingly used alongside conventional treatments in the West. This traditional Chinese medicine technique involves inserting thin needles into specific points on the body to balance the flow of energy, or qi. Modern research has begun to validate its efficacy in treating various conditions, from chronic pain to stress-related disorders. How is acupuncture integrating into modern medical practices? Modern research supports the ancient idea that mental and emotional well-being are integral to physical health, as seen in practices like yoga and meditation. These practices, rooted in ancient traditions, are now widely recognized for their benefits in reducing stress, improving mental health, and enhancing overall well-being. Studies have shown that regular meditation can reduce symptoms of anxiety and depression, while yoga has been proven to improve flexibility, strength, and mental clarity. How are these ancient practices influencing modern mental health treatments? The convergence of ancient healing practices and modern medicine is leading to new, holistic approaches to health and wellness. For example, the use of herbal remedies alongside conventional treatments is becoming more accepted, as is the integration of mind-body practices like yoga and meditation into mainstream healthcare. This blending of ancient wisdom and modern science is not only enhancing patient outcomes but also fostering a more patient-centered approach to care. What new approaches are emerging from this convergence? Advances in genetic research are enabling personalized medicine, which tailors treatments to individual genetic profiles. This approach echoes the ancient personalized care seen in Ayurveda, where treatments are customized based on an individual's dosha. Modern genomics allows us to identify genetic predispositions to certain diseases, enabling more targeted and effective treatments. How is personalized medicine reflecting ancient practices of individualized care? Holistic health movements, such as the wellness industry, are growing, reflecting a return to ancient practices that emphasize overall well-being. These movements advocate for a balanced approach to health, incorporating diet, exercise, mental health, and spiritual practices. The popularity of practices like Ayurveda, yoga, and meditation in the wellness industry underscores the timeless value of these ancient traditions. What role do these movements play in modern health and wellness? The integration of ancient wisdom and modern science is shaping a future where healthcare is more patient-centered and holistic. As we continue to explore the connections between ancient healing practices and contemporary medicine, we are likely to see even more innovative approaches to health and wellness. This fusion of old and new promises a healthcare system that not only treats illness but also promotes overall well-being. What does this integrated future hold for medicine? The legacy of ancient healing practices continues to influence modern medicine, ensuring that the essence of care remains timeless. From the Ebers Papyrus through Ayurveda, these ancient texts and practices have laid the groundwork for contemporary healthcare. As we move forward, it is crucial to honor and integrate this wisdom to create a more balanced and effective approach to health. What can we learn from the legacy of ancient healing practices? By understanding and integrating the wisdom of ancient healing practices, modern medicine can achieve a more balanced and effective approach to health. The convergence of ancient and modern knowledge offers a path to a future where healthcare is not only about treating illness but also about promoting overall well-being. As we continue to explore these connections, we open the door to a more holistic and patient-centered approach to medicine. What will the future of integrated healthcare look like?